Welcome to Dr. Lottie's Science with Soul. I am Dr. Lottie and the host of this podcast. Today, I am so excited to introduce Dr. Jennifer Markham. And we actually have a little bit of history because we went to medical school together and we sat together in the last row of the lecture hall for at least the first 2 years, right? But 2 years, or was it longer?
I think it was maybe at least 3 years because of our time in that hall. Yeah.
Many hours shared in the back row. So let me introduce you to Dr. Jennifer Markham. Dr. Jennifer Markham is a naturopathic doctor, public speaker, artist, and writer. She earned her doctorate at Southwest College of Naturopathic Medicine in Arizona. And through the years of study, she became certified in Biotherapeutic Drainage and gemstone energy practitioner. She loves working with energetic, vibrational therapeutics to assist the body, mind, and soul in harmonizing. With a background in music and art therapy, Dr. Markham uses sound healing frequencies and color therapy in her work with individuals. She infuses therapeutics such as craniosacral therapy, acupuncture, kinesiology, gemstones, and trigger point therapy into her practice. At the age of 7, she suffered an unknown illness that brought her near death. And it was at that point that fasting, yoga, and meditation became part of her life. Her spiritual focus carried her throughout several more spiritually transformative experiences and years of debilitating illness. She studied and searched for the truth about health and disease for years, and spurred by her own desire to become free of chronic disease. Her own experience eventually led her to medical school, which in turn led her to her mentor, and ultimately her own journey back to health, the journey back to self. Dr. Markham is passionate about working with individuals who are experiencing chronic disease and who desire to be free within their body, mind, and soul. She believes that we are spiritual beings on a human journey, and she loves to educate, inspire, and empower individuals on their unique healing journey. She sees many different conditions in her private practice at Vitality Healing Center, with her primary focus on chronic disease, autoimmune disease, endocrine disorders, gastrointestinal problems, and neurological conditions. She is currently writing 2 books, a nutritional Chinese medicine book and a book on her spiritual journey, full of poetry and musings. She is so excited to be joining forces with other individuals in the creation of one of her dreams, an eco sanctuary center, which will bring together various modalities of healing, the arts, education, and experiences for the support of living in harmony with nature within and without. If you're interested in working with or contacting Dr. Markham, you may do so on her website at vitalityhealingnd.com or through social media at Vitality Dr. Boo. So welcome, Dr. Markham. It's such a pleasure to have you join us today.
Oh, thank you, Dr. Lottie. It is an immense pleasure and such a joy to see you and speak with you again. It's been quite a few years.
Right? It seems like time just flied. I mean, we graduated 2016 and now it's 2022. Seems like we got out 2 years ago, not 6 years ago.
Yeah,
I know what happened to time. So I remember you in med school and you were still struggling with some of your health concerns, even in medical school. But your journey started way back, even when you were just a child. So tell us about what happened when you were just a child and 7 years old.
Yes. Well, yeah, indeed. I was not, I was still experiencing, my health journey is a long one. And as you mentioned, when I was 7 years old, I had become quite ill. And what I recall from it is that the doctors had said they didn't know what was ailing me, but that, and they thought it was maybe something viral, was what they had termed it. And they didn't really have any advice for my parents, but they gave me some antibiotics and just said, rest as much as you can. But I was losing a lot of weight and I was just skin and bones. It was going on for at least 3 weeks. And at that time, I began to um, be more connected to my spiritual being, this other more metaphysical component of life and dreams and such in that state. But my journey then continued, and I did recover, of course, and began eating a lot. But it was again when I was 12. I remember having a lot of allergies, and then at 14, it was like suddenly I became extremely depressed. That was a kind of this thing that I remember being told, well, we don't know why this happens, but it seems to happen in certain families or for certain reasons. And so there's not much to do to ever make it go away, but we can manage it. And at that time, at 14 years old, I thought, well, that's just crazy. I feel like there's got to be a reason, um, and a way to not feel this way because I didn't before. So there's something that happened. And so the journey goes on. And in my early 20s, actually around 18 years old, I became extremely ill and was not able to work or drive or walk. It was really debilitating for months, and I couldn't care for myself. And I began to study a lot more about healthcare, and I began to see an acupuncturist, and I became even more active in yoga, which I had begun around the age of 11 on my own. And although there were things that I changed and implemented and got support with, I didn't see true shifts. I would feel better for a period of time, a few months, or even I would be pretty good for a year. And then something would trigger me again. And often it was a stress, emotional stress, which I was aware of. And then I would get sick again. So in my early 20s, I was diagnosed with ulcerative colitis, which is an autoimmune condition which causes, as you know, ulcerations in the lower digestive tract in the large intestine. And I was again told that that was something that was incurable, using that word, but that was the words of the doctors at the time, was incurable and something that could hopefully just be managed, making steps around my diet and things like this. So I continued to focus on natural modalities, and the medications that they offered me actually didn't do anything. It didn't make any shift to my symptoms. So I made diet changes and I became much more engrossed in meditation and yoga. And during those periods of time, if I did things what seemed like just right, then I would have this period of time where I felt, like, okay, I'm making progress. I feel like I'm managing myself well, but I still felt somehow like I wasn't truly myself. That's a feeling I always had. And so it was sometime in my mid 20s, I found out about naturopathic medicine, and mm, excuse me. Um, and right afterward, I decided I'm going to go to naturopathic school, but the journey of healing was just beginning then. So I met my mentor in my first few months of school, which is a blessing because he helped lead me through what I would call now my healing journey and what I often do with patients. So it was not an easy road. And I guess I say easy because it's like anything that you go back to that saying, anything worth doing is, or anything worthwhile is difficult. I don't know about, speaking those type of mantras, but how I experienced it and based on what I needed to go through, I believe on my spiritual journey and my knowledge gaining was, going through naturopathic school. I went through a lot of continued issues with this autoimmune condition. I also experienced lots of musculoskeletal issues, um, pain, injuries, um, things like allergies came back into the picture, and issues with sinuses and digestion and mood. And so it was very consuming, and my health had always been at a certain point, especially since 18, became consuming. So luckily throughout school, and as I learned and I was mentored and supported along the way, um, I feel like that was really the beginning of my healing journey, from a place that made sense, that I believed and understood how my body and being had come to this place of illness, and that I truly believed that it was possible to reverse it and to return to myself, or to become who I felt I was meant to be, without this physical ailments that were really just like debilitating at that point. And so the journey was probably a good 7 to 9 years, which I believe is longer than most people out there when it comes to really focusing in the way that I work with patients. But I'm grateful for that journey, because I went through so many different experiences, physically, mentally, emotionally, spiritually, that led me to where I am today. And so it's been a long one that was quite full, but um, I I have to say again, grateful for it, for all that I've learned and experienced along the way. Looking back, of course.
So you met your mentor right at the beginning of medical school, and what is it that you learned? I know you became a specialist in the biotherapeutic drainage. So is that what ended up healing you?
Yes, yeah, great question. That is, biotherapeutic drainage was what I was being taught by my mentor. And in fact, in school, I began to run the what was called the drainage club, and later was uh, enveloped into another, society at school, which was vitalistic in nature, meaning more of the old school, even naturopathic practices. So biotherapeutic drainage was what my mentor was teaching, and ultimately those therapeutics, the same things that I learned about and then was also being implementing into my health practices month by month, year by year. Those are all the same tools that I use now, is what I was learning, and also, you know, so to speak, used on myself, or benefited from greatly, and had the first person experiential learning.
So I know you began focusing on your spiritual journey at a young age, turning to ancient practices, and you had several spiritually transformative events. So can you tell us a bit about that spiritual journey, or is there any particular memory of a spiritually transformative experience that you want to share, or anything about that?
Yeah, that's a great question. That's a great question. Um, recently, and it's interesting that you just, asked this, is that recently I have been thinking back to the period of time when I began to, um, just study into and began practicing, as I said, around 11 years old or so. And I've been thinking back in those times. So I'll share a little bit about that. I don't really recall how or where I had gotten this book from, but my family, we had a yoga book, some yoga practices in there. And I enjoyed reading, but I rarely turned to, I don't know, self help or like this type of book. So I remember one day sitting down and I was reading it and I was looking through it, and I began to see if I could do the yoga. And then that led into, I played piano since I was 3 years old. So I played piano pretty actively. And I would use sitting for hours playing piano, or singing, as sort of the getting in the zone, or I would say a meditative place, and sit in meditation or lotus. No one else in the family did this, and I had no examples around me, and I didn't grow up with examples of this. So I just also began walking out in nature. I used to raise my own raise and train my horses. And this was at a time where we lived on 40 acres. So I had the pleasure of walking around for hours or better part of a lot of days. And I did so by myself. And I'd find these little sweet sanctuary type places all over the property, by the pond or with my back against the birch or on the rocks or in the field, overlooking the land. And would just, I don't think I was actively trying to, I didn't know what I was doing really at that time, but I was sitting in meditation and experiencing, connection with the spiritual realm, I believe, and getting guidance. And at that time, it was a funny thing about that is I just used to travel a lot by myself and my horse. And I was like 13 or 14. We lived very far from town, but I would just get on my horse and go where I wanted to for a very long period of time. I remember my parents didn't know about it right away, so we can all laugh about it now. But it was a a beautiful time to be able to have the freedom, and what I was drawn most to was to be in solitude in nature and connecting with spirit. But throughout the years, it's not as though I kept going with a strict or constant yoga or meditative practice, but it- having had many or several spiritual transformative experiences from such a young age, and especially following periods where I would have extreme illness for a long period of time, excuse me, especially especially following periods of time where I would have extreme illness for a long period of time, I would always end up becoming drawn back to some fasting, conscious at least, in what I was putting in my body, only to what I really desired, which often would be at least intermittent fasting, and then drawn to meditation and just a lot of solitude, again, to connect with spirit, and having experiences also in Native American practices of the vision quests. I was always drawn to things like that. And there are certainly experiences, I guess the most intense one would be when I was going through the symptoms of uh, what felt like I had broken a hand or a wrist. When there was imaging done, that was not the case, but that extreme pain following a spiritual journey, I began to experience symptoms of a heart attack. And as you might imagine, with our medical knowledge and experience, this was at a point that I knew what those signs were.
So this was
And
after you graduated from medical school. So you
yes,
were
this
completely aware of your symptoms.
absolutely, absolutely, completely aware. And other people were relying on me, the other people there who began to help, um, and try to assist in some way, relieve pain or position me or whatnot. They were saying, well, do we need to call, do we need to call 911? What's happening? And so it was a very interesting experience being sort of the director and the evaluator, the physician in this case, yet experiencing the symptoms. But that was a deeply spiritual, spiritually transformative experience where I, um, was experiencing very severe symptoms of heart attack and like symptoms, and recall leaving my body at that point, at that moment, and going into a spiritual experience to give me the messages that I needed at that time. And part of that was the choice, and choosing to be here. So I feel like life has been really spiritually focused in the sense that, without recentering on my spiritual or soul, and the purpose in that way, I would have indeed either succumbed or not chosen the physical tools or the pathway that I did. And, I believe all things as they should be, but I'm grateful. And it's just definitely, it's been a journey so far.
So what happened? Did you end up calling 911 or?
Yeah, yes, I understand. Want to know a little more. Yes, I had them call 911. I had the ambulance come. I was experiencing what I thought maybe was similar to also like a drop in blood sugar at the same time. And my hands, my feet, and my whole body were clenched up, and I couldn't unclench. And it was like a fire electric feeling going on my arm and my neck, and my face was turning cold, and the whole side of my jaw. And pain, pain like I've never experienced before. And there was a moment there because there was several people, and these people, I know some of them now, but others I had just only met the day before. And they were filling in, like this one gentleman, I remember his name was Kevin, I believe. And to me, he was like the Christ figure. And he was right there with me. And he says, "What do you want? Like, what do you need then?" Because I really felt like I might die, and I really wanted to be able to do something about that, you know?
So
And
is this the paramedics that arrived?
no, this was before the paramedics had arrived.
Okay, so these are
Yeah.
the people that you're surrounded by.
Yes, that's right. And I was out somewhere that was good 30 miles, or, 30 minutes for ambulance to get out there. So they were trying to support me. And I remember asking for a mix of juices, lemon juice, orange juice, basically some citrus and honey. And they were just pouring the honey in my mouth. And I was having them shove uh, their finger in this acupuncture point here, important one, and just trying to breathe. But so people were reminding me to breathe, and they were holding my body, which felt like it was to keep me there. And when he asked me, "What is it that you want?" And I'm thinking, this might just be it. Like I have to, but without much thought, I said, "Speak to me the truth. Tell me the truth. Just remind me of the truth." And and it was a while. I started to be a little less, like a slight decrease in pain, and a little bit of ability to move my hands. I had a breakthrough after I had gone to this starry kind of the black space type of, felt like it felt like being out in space, and I had gotten the message that I needed to. When I came back and realized I was still here, then I I was still experiencing the pain, and I kept speaking to the pain. And then there was a moment where I said, "The physical isn't the physical." And it was like this huge epiphany to me. Like I knew it, but I knew it for real within every fiber of my being. The physical is not the physical. And in that moment, then the fiery electric, just excruciating pain throughout my body just felt like I was alive. It felt like light running through me. Felt like ecstasy to be alive. And I could see how the mind and the choosing in that moment was so powerful to recognize even this pain can be shifted. And this physical thing is not going to come to my, I'm not going to die in this moment. And so it's just this spiritual, emotional experience. And wow, was I grateful, and also just it was hugely transformative. So yeah, the paramedics arrived, and I was taken in, and all of my vitals were normal. It did take them 3 times to trying to get an IV in my arm, but I was just, chipper with them the whole time, because I had just had this huge, transformative, recognition. Just blew my mind, in the best way possible.
Nothing like a spiritually transformative event to as a little wake up call.
Yeah. Yes.
But it sounds
Yes.
like you've been through, several of these healing crises of different types that have then given you these spiritual awakenings each time.
Mhm.
So with each event, it's like you're propelled into the next chapter of your life, right? So
Indeed.
if
Indeed.
I would not be surprised if you're gonna, if a couple of years goes by and then you have another event, because
Oh
the spirit
goodness.
world is saying, "Oh, I think Jennifer is ready for her next event now. Let's move her forward a little bit."
Yeah. Well, I'm not surprised you said that, because I have had that sense about my experience. Like I could imagine this happening again, in some degree. And I don't wish it, in the sense of it does feel like opportunities when it's a wake-up call or a real strong redirection or message for my life. But without the idea of um, blame, then that takes away, the fear of not getting something right along the pathway. And so, spirit has come down and hit you with a lightning bolt kind of thing to wake you up. But it's all part of its chosen journey. That is the journey back to the self or the soul.
Yeah, beautiful. Sorry that you've had to have all these healing crises, but ultimately, like you said, it has made you the person you are today. And
Hmm.
so I always talk about that myself. I incarnated for, being sick for many, many years before I went to med school. It is
Hmm.
part of my journey, and I wouldn't be here today doing what I do. And it sounds like you have a similar journey. We just have different experiences along the way, but it's propelled us. It propelled both of us to go to medical school and to find healing and to help other people heal.
Absolutely.
So I want you to talk about the drainage. Tell people what drainage therapy is and how that is different from detoxification.
That's a great
A
question.
lot of people don't know what drainage is, right?
Right.
Or what drainage therapy is.
Well, and yeah, you're absolutely correct. A lot of people know about like detoxification. Oh, I'm going to detox, or I'm going to go on a cleanse, all great. Drainage is different in the sense that it has a physiological, so drainage is like a physiological action that facilitates the body to remove toxins or aggressors or things that are built up, whether they're natural or unnatural, within the body. And it does so at the extracellular matrix level, so the space around each of the cells. And it it is it never surpasses physiological limits. So if I could sum that up again, drainage is a physiological, facilitation um, within the body that would help the extracellular matrix, a space around the cells especially, to eliminate toxins, to eliminate aggressors through the emunctories, which we can get to emunctories in a second. You've probably spoken to these in the past, but then again, not surpassing physiological limits. So it's different than detoxification in the sense that detoxification as well as deprivation, they often can or will push the body past its limits. For example, for an extreme case, let's say if somebody was doing heavy metal detoxification while, someone who's certainly educated and trained and versed in it, have many tools and understanding about it, but there is still just the slight possibility that, or sometimes great possibility, it depends on the individual, that going to remove, or what we call deprivation in that sense, removing the heavy metals through some type of oral or IV means, and then trying to return minerals and vitamins to the body in the best support possible, can cause a person to go into some type of organ system failure, or at least a great amount of stress, at the least, because it may be too hard for the system to handle. So drainage supports the body in elimination on all these different levels within the body, especially that extracellular matrix. But with a very gentle yet effective methodology.
So when you do drainage therapy, how do you do that? Do you use herbs? Do you use supplements? Do you use homeopathic supplements? Or what does that look like?
That's a great question. I had one mentor of mine in the past state that a very true thing to note, that drainage could be done in theory with any type of therapy. Of course, if something is, let's just say something like a medication, say you could take too much and it could be toxic if you're taking too much. In that case, if you were truly using medications, for example, then you might, um, it would be more about the quantity and how you were approaching it. But in my experience, with that being said, drainage could be done with all these different things like herbalism, botanicals, homeopathy, flower essences, so forth. I primarily do tend to work with homeopathic remedies, cell salts, and um, combination, which are still considered a single remedy, that are more herbal based. So a lot of it is subtle medicine or homeopathic medicine. Yeah, a lot of it is aimed at that. While I do facilitate or utilize, rather, I do use um, like supplements and changes in one's diet or support of nutrition that would act, we would say that would act more on the physiological, physical level. And then homeopathic remedies working in conjunction with the body and all together, supporting more on the subtle level, still on the physical, but that's where we can start to get into things like the extracellular matrix, because they themselves are not remedies. Homeopathy would not do something to the body. It doesn't cause a symptom. For example, like if you took too much magnesium, you might get, loose stools or sleepy or something like that. It's not like if you took too much of these homeopathic remedies, they're going to cause something by their physical effect, but rather they may stimulate your own body's response within its own physiological limits to go through the elimination or process on that physical, emotional, subconscious, cellular, vibrational level. It's really fascinating and powerful medicine. So I do work with those things again that I experienced and was trained in, and had used throughout years for my own health. So I know them intimately in that way.
I love it. And then what you mentioned, the emunctories. So that is a funny word. So can you
It
explain
is.
what that is?
I like to teach about it. It's one of these old words, right? So an emunctory is basically an organ or it's a path of elimination. So elimination of what have you, let's just keep it simple and say toxins from the body, or which in turn would perhaps change inflammatory states and things like that. But let's just say we're wanting to remove, and in this case, that's part of the work that I do with people. So supporting the body to eliminate toxins, and emunctories are the ways in which they eliminate. So we have primary and secondary emunctories. Let's see if I can get these all. So the primary is the large intestine, having bowel movements, and the urinary system, urination and mineral balance, and the respiratory system, the lungs, so breathing out, those toxins, let alone CO2 is our primary one there. And then the skin, as far as just sweating. And then there are the one that often gets missed is the emotional emunctory. Indeed, yes, we cannot separate and reduce the body and the being, from like emotions separate from the physical, which most people, that I know, can recognize that in their own life. Like, I know stress or XYZ, which causes me stress, makes this or that worse, or has had some sort of experience where they know stress is directly affecting how they're feeling. So emotional, that which is present, known, and that which is not. But the emotional emunctory must be functioning. And that is perhaps the biggest emunctory when we speak of needing to support the primary emunctories to allow detoxification or elimination through the body. But there are a couple secondary emunctories, the mucous membranes, like if we talk about someone having a runny nose or separation, meaning, snot coming out of their nose, or congestion in their sinuses. Or also you could speak to the digestive system and a bit to that degree with the mucus lining in the gut. But primarily we think sinuses or the vaginal tract, or the ureter. And then secondarily also is the skin. So we'd say anything that happens on the skin other than sweating, and other than contact dermatitis is not the skin. So whatever shows up on the skin is not just skin, it's due to some other organ system or conglomeration of organ systems. So primarily with the emunctories, we open them up and we support them and the organ systems and the emotional body to safely and effectively eliminate the toxins, which the body naturally produces and needs to get rid of, and that which we might be exposed to in the environment and have brought up around us, including traumas and illnesses and accidents and things like that. However it might appear, it's all imprinted within the body and to various degrees are eliminated then through supporting the emunctories, which would lead me to castor oil as one of those components. But the tools for drainage and the modalities for drainage are supporting the emunctories first and foremost, because you can give the body a lot of good stuff, but if it's only able to process a small component of it and utilize a small component, or it's not able to get rid of its toxic load, it's kind of a bit of a spinning the wheels or a slower go.
Yeah, so tell me about the castor oil.
Yeah, I could. All right, I'll try not to talk forever about castor oil. I could get one of my, patients on here to just talk about castor oil. So castor oil comes from the castor tree, ricinus, and the bean itself is toxic if you were just to eat the bean. But what is done to make the oil is the beans are collected and it's made into an oil. This oil, castor oil, also known as the Palma Christi or the oil of Christ, right, I primarily use it in support of the lymphatic system, and we talk about medicine. The lymphatic system is one area that doesn't have a specialist. And there's a lot of importance to the lymphatic system, as we know, with the lymph nodes, kind of garbage collecting and filtering the blood and supporting the immune system. So castor oil greatly supports the immune system. And, I have my patients and I myself have for years utilized a castor oil wrap, which provides like a flannel over the abdomen, which is where most of the lymphatic chain is in the gut. And a lot of health issues do have a foundation in what's happening in the digestive system. So this castor oil goes over the abdomen, and the pack is worn for some time. And while that is primarily the way it's used, it's also applied all over the body for various reasons, including to help with areas of scar tissue, pain, bruising, sunburn, you name it. And it is historically, from my experience, it was prescribed by Edgar Cayce to his patients. And you perhaps could speak even more directly to Edgar Cayce, but he would get clarity on what might be wrong with individuals on a physical level, and would prescribe or recommend various things to support their healing process. And castor oil is a huge component of that. So I love castor oil. I love it so much that I went ahead and designed a pack for that, which makes it easier, to wear. I'm very comfortable. But I love castor oil, and that's a big component to supporting the emunctories, even the emotional. And I know some individuals who use a castor oil pack on the thyroid. We see it more and more in skincare and hair care products to use castor oil to help hair growth and to, help circulation to the area. But that's what it does. It increases white blood cells within the first 30 minutes. It increases blood flow, helps move inflammation. Basically, it aids in healing, but it also aids in the lymphatic system becoming, um, let's just say, easier, allowing the lymph to move more easily. And the lymphatic system is a huge component of supporting the liver and all the detoxification of everything that we encounter, eat and drink. The liver's job is to help detoxify or process through that. And the lymphatic system is right second, or equally in line with helping in that detoxification and movement of good nutrients and things to get out. And so the castor oil is foundational in what I have my patients do.
Castor oil is amazing. It's so good for so many different issues.
So
So
many.
let's switch topic for a moment. I know you work with sound and color therapies and harmonizing body, mind, soul, and resonance of the body and the health and disease. Can you speak a little bit about all these different subtle energies and therapies that you do?
Yeah, absolutely. I do love to speak about, and I find it beneficial from perhaps my musical background, um, to speak about health and disease in terms of resonance. So you could speak about it, and it's been shared. This is shared from someone else to me, but I love to describe it as such. So imagine like all of the organ system of the body are parts of an orchestra, and they're all supposed to be playing the same song to make a beautiful, melody, a harmony. And when there is dis-ease or disease on whatever level, physical, mental, emotional, maybe just more spiritual, um, then it's like if you go to listen to the orchestra and you got like, the flute's playing a little off and this violin started at the wrong time and the drummer is not, the percussion is just totally offbeat. It's like it's disharmonious. It's not this beautiful sound. You might have an idea of what it's trying to do. You get in a sense of what the song or whatever might be, but there's not harmony. So when working with individuals with whatever they're coming to see me about, will notice where the body is speaking to where there is disharmony or dissonance, meaning not resonating optimally, um, within the body, within certain organ systems, or um, within the mental space, the mental mind, um, or or the belief systems around the spiritual, and usually, honestly, it's a combination of everything. But if we're talking more simply like the physical, then there's disharmony in it, and the therapeutics, the remedies, whatever it is that I use with patients, I end up focusing on what is your body and what are you telling me as the patient, what is the priority area that is in least harmony and needing support at this time. And what ends up happening is there becomes a more harmonious and more resonance and optimal function within different areas of the body when they are supported. And then usually something else pops up, and it's like peeling the layers off an onion. So I love to incorporate, as you mentioned, sound healing and color therapies. Again, most people would have exposure with the colors. We think about the chakras, from the root, which is red, to the crown, which is this violet. There are energetic color centers, so to speak, with each of these chakras. And that is a simplistic idea of how to support, or how to rather know what colors to use to support various areas of the body. And I realized that those are more subtle. But what I'm finding more and more in the last few years of practice is that the more subtle, and I knew this before, but really the more subtle, the more powerful. And there's time to absolutely address the physical first, and primarily that's what we do. But using subtle therapeutics, when we get further into the emotional and the spiritual body, are immensely useful. And same with using like the notes or chanting or tuning forks, or different brainwave, like the delta, the beta, the alpha, the theta. I primarily would aim more towards the delta and the theta for the therapeutic meditative type of state. But those are also, I guess you could say, sound, using hertz or frequencies to have an effect on the cellular level of the body and help to actually almost physically change the vibration of the body. So disease is like that messed up orchestra, and then health is harmony within body, mind, spirit, soul, and vibrationally. So then all those instruments in that orchestra is just like a beautiful, beautiful symphony.
So I know you're working on two different books, and what is next for you?
That's a great question. Um, I I love writing, and I have, as you mentioned, I am working on the two different books, and they are, quite different in the sense of the one as a spiritual, the other nutritionally based. But I'm able to combine some of my photography background and artistic background into the creation of these books, and so I'm enjoying that. And I have, I have, as I mentioned, or as you mentioned in my introduction, I'm really excited, and what's upcoming and what I'm participating in now is some group support around energetic medicine, energetic healing, things like using different elixirs, flower essences, and gemstone therapies, as well as various different practices that are based in Chinese medicine, um, which affect we know about the meridians that are on the body. Well, there's the meridians that are off the body, into the more subtle bodies. So tools and little exercises, so to speak, to do, and teaching others these things to affect the subtle bodies outside of the physical. And I love to participate in ceremony and such, but and been facilitating some of those things like cacao, and so just more integration into the community, but most excitedly moving towards, as you mentioned, the eco sanctuary, and the network of other healers, other physicians throughout the United States, but also throughout the world, who are aimed at creating healing centers for teaching, for the various arts, for the various healing modalities and opportunities for immersion and experience. And, I think of it as an example of living in harmony with nature. And so that's my aim. And so it is, it's just starting to blossom in the last year. And there's exciting things coming, but I often, by my very nature, would be holding that little excitement inside without too many of the details. But there are some things to come, and definitely what feels like soul family and collaboration that way, which is a great joy for me. It's one of the dreams that I've had for almost a decade. And while health and, for one, finishing medical school some time ago now, that was a primary focus. But you can't push the dreams, but showing up in each moment and enjoying working with the subtle and energetic energies, and teaching about these things, and how we go from from disease to health, and how disease really happens in the body. And so I love collaborating with others to be able to teach and share some of these tools that empower and inspire and educate others.
Ah, beautiful. So tell me, how can the listeners learn more about you or book an appointment with you?
Yes, they can find me on my website at vitalityhealingnd.com, and on various social media at Vitality Dr. Boo. And I can also be found, I think, on LinkedIn and a few other social media type platforms that are maybe less common. But I am available for questions, and people can just send me a form or give my office a call and set up a time to just have a discussion, a brief discussion with me, um, about where you're at, or whatever you'd like to. So
All right. So I will be putting her website, vitalityhealingnd.com, as well as her social media at Vitality Dr. Boo, in the podcast notes. So you can just go to the notes and you can click on the link and it will take you straight to her website. So I want to thank you, Dr. Markham, for taking the time and joining us today and sharing your journey.
it was an absolute pleasure. Thank you, Dr. Lottie. It's just so good to see you. Wonderful to share these memories and to be with you today. Thank you.